Okay. So, we're going to first clean this wound. The basics of wound management is soap and water. It is nothing crazy. People always think you need to do hydrogen peroxide, and you can, but for the most part, just cleaning the wound with a bit of water is all you need. We have, though, fancy wound and skincare solution, so we have access to that here, but if you're in a pinch, soap and water, which I will do for the most part here. So you got this down in the where did you get it? Where did you get this injury?
That was the Indian River.
Okay, Indian River. That's nasty.
Yeah,
so,
it was moderately clean, clear water at
okay.
the point that I was at. So.
Okay. Bit of soap. And we're just going to try to clean this out the best we can. Soap and water. Okay. Okay. So with the basics, my favorite is iodine prep solution, 10%. This isn't your average Lugol's, it's a bit stronger. Lugol's is typically, I recommend people consume 2% Lugol's. This is a 10% product, a little bit harsher. I don't try to get it in the wound necessarily, it might delay wound healing. I try to get it at least around the skin. Very good. The basics here, we have lidocaine, a syringe, a 30 gauge needle for injecting, and a 23 for drawing. Let's see if this is on. So we clean the rubber stopper. We punch it through like that. Punch it through like that. Plug it in like a Lego. Jab it through. And draw a healthy amount of lidocaine. Take our 30 gauge, screw it in, make sure it's primed and ready to go. And the next point is getting all around the wound. What we're going to try to do is infiltrate everywhere we think we're going to be. So this is going to be poke, and we're just going to try to infiltrate the wound. You can see it bubbling up there. Oops, it came out. Try to stay in the wound and just try to move around with the needle. It'll see it bubble up. That's kind of the worst part. Then I'll try to go in where it's numb and then redirect the needle here. Painful. And then come here, infiltrate this area of the wound, and this here. Oh, this is just regular lidocaine. There's no epinephrine in it. So there will be bleeding. It doesn't vasoconstrict. Always pay attention when you're using lidocaine that it's not a lidocaine with epi, because vasoconstriction is good if you have like a big wound and it's bleeding, but I don't supply that here in the office just to avoid mistakes. Because if you inject lidocaine with epi into a finger or a digit, it can be bad news because there can be lack of circulation in the digit. So, if I ever dispense one of these for post-apocalyptic survival, it would be lidocaine, just plain old lidocaine. Okay, very good. So we probably won't need any more of this, but we'll keep it there anyway. Move my soap out of the way. We have here two types of sutures. So I have a 3/0 nylon and a 4/0 nylon. For this wound, I'm going to select a 4/0. A 3/0, I mean, you could make the case for doing a 3/0 because it's like over a joint, but I think we'll be fine with just a 4/0. I'll just do a couple more. 3/0s, you do it over a joint that like moves a lot, that could break open. I mean, let me see. I mean, it's a possibility. He's going to be moving his ankle. Well, we'll see. We'll try the 3/0. If it's too wiry, I'll use the 4. But the problem with going thicker is that it's harder to use, so it increases the difficulty of the suture, but I can do it. The thinner, the easier it is to complete. But the thicker it is, the less chance it'll break with movement over a joint that moves a lot, like the Achilles that we're dealing with here. Oh, some other cool things to review here is the high-temp electrocautery. This might be useful to have in a survival pack, right? Because if you have a bleeder, right? You have a little vessel that's bleeding, you just hit the button and this thing electrocauterizes it. But we don't have anything like that to deal with here. We have our McKesson suturing tray. One use only, really. Although if it's post-apocalypse, you would totally keep this and keep using it. You just would clean it off. So the contents of this, it's a sterile packet. We have this thing, which we can use it. We'll show you what that looks like. So it's kind of a little cool little drape here. Keep your area sterile, right? Because we cleaned off the area there. So in case your suture goes over an area that's not sterile, it doesn't contaminate the wound. This is, we don't really need this. Now we got some gauze. We might use this gauze here, keep this here. We have alligators. We have scissors for cutting. And we have tweezers with teeth on them, very important for grabbing skin. Okay, give me this bad boy. Grab your suture. Okay. Those are a little big. Okie dokie. So we grabbed it like so. Oops. Professors would get mad at me for grabbing the needle, but I'm careful. Okay, actually, I'm going to go this way, backwards. I'm going to grab this, and what we're going to try to do is approximate this. I'm going to start here, puncture, take a nice big bite there. You can come through, or if you're a pro at it, you can go right through and out the other side. And then you grab it here, pull it through. Oops. Bring it in pretty close. Then inside, wrap once, wrap twice, grab your thread, and pull it together as so. You can see I'm keeping the the two ends opposite. And ideally you want to keep it on one side, so I need to make up my mind. I'm going to try to keep it on the stronger end of the skin there. In the middle again, one wrap, grab, and pull. In the middle, grab, and pull. And one more for good measure. So I think that was like 4. And pull. Okay, scissors. So always scissors flat on the patient so you don't cut anybody. Let's try to not get blood everywhere. Okay, making progress here. Right in the chunk, right there. Good. And come out the other side. Oops, no, that was not enough. Well, maybe I'll do 2. Pull it through. So this is another technique to do if you want to make sure you're getting deep enough into the opposite tissue. Pull it back, go in, and then pop out the other side. There we go, that's a nice big bite. Dun, 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 dun. Let's clean this area off so we know what we're doing. In the middle again, grab the other side, pull. Again, I'm going to put my sutures on one side, in the middle, grab, pull, middle, grab, pull, middle, grab, pull. So that was 4. Scissors. I don't want them too long, I don't want them too short. You want to be able to find them because you're going to have to take these out at some point. Over a place like this, about 10 days. Over joints, it takes a little bit longer to heal. So like 10 to 14 days over a joint. Although in young, healthy people, it heals a lot faster than that. That's just recommendations. Like, I bet he'll be healed within 7 days or quicker. Over like the face, it doesn't take long. It's like 5 days. Other parts of the body, like 5, 6 days. Okay, now we have a little interesting puzzle piece here. I'm actually going to flip it to this side, so I'm going to go that way. It's a little triangle piece. Yep. So I'm going to do the same thing. I'm going to actually come out. Just going to see what I'm up against here. Sorry, buddy. There probably wasn't enough lidocaine there. Oh well. Done is done. In the middle. In the middle. I'm actually glad I did the 3 O's. Okay, well, bleeding's controlled because we got it all sutured together. Looks pretty good. There's not much more I can do there. So this, I'm going to throw it away, but in a post-apocalypse, you'd probably just clean it with alcohol and save it, same as these, which actually I'm going to clean these and save them because I'm going to cut these out on him in about 10 days. So the way they're cut out, I'm not going to do it, but you basically, you kind of like grab the, now these tweezers are terrible for grabbing. I'd actually use an alligator for grabbing them. But you basically, you grab it, you lift it, and you go underneath the suture, and you snip them out, and then you just pull it right out. So there's nothing to taking it out. I oftentimes will have patients take them out themselves if they're up for it. Very good. Where's my cleaner? So wound care, and people always ask me, do I need to put anything on the wound? Actually, no. Best thing for a wound is air. So air and oxygen is antimicrobial. So the last thing you want to do is seal a wound. That'd be a terrible idea. You actually want it to be open to the oxygen because oxygen is antimicrobial. To help with scar formation, you can put vitamin E ointment on it. That's fine, or and really just soap and water. If you notice, there's little crud on there, soap and water. That's the only wound management you want to do for something like this. You don't need to put iodine on there necessarily. I mean, iodine might delay the wound healing, might open it up, so I don't necessarily recommend putting iodine on there. If it looks like it's starting to get infected, sure. Iodine is a great antimicrobial, better than antibiotics for a local wound like this. But soap and water is probably the extent you want to do. Now for him, it was a nasty wound, nasty cut. There's a possibility it gets infected. We did our best to kind of clean it out, so we monitor it. But he's a healthy young kid. He should be able to beat something like this, just soap and water, cleaning it every day. Maybe some iodine on top, like 2% Lugol's. You can brush some onto there. That would be the extent. If the worst comes to worst, the choice of antibiotic for something that you got from the river here probably would be Bactrim. Bactrim is a broad-spectrum antimicrobial. It takes care of MRSA. For regular wounds, you would use Keflex or penicillin, obviously if they don't have an allergy to penicillin. They used to recommend using like a fluoroquinolone for something from the river. I don't like those drugs. They're very bad. They cause tendon ruptures. It's no good. So we try to avoid antibiotics. We don't just give antibiotics for wounds. That's not recommended. You only give it if the wound actually is infected. But still, I would first of all just use topical iodine for any infection, any microbe. And that's that. All right.